Hi, everyone, and welcome to our additional media offering with the Maine Health Center for Tobacco Independence Training and Education team. For this quarter's Soundbite, we're going to be talking with David Spaulding, who is a senior program manager at the Maine Health Center for Tobacco Independence. We're going to start out today by providing a little bit of background information on the Maine QuitLink, and then we're going to review some frequently asked questions regarding making referrals to the QuitLink. Before we begin, thank you so much for joining the conversation today, David. I'm looking forward to chatting about the QuitLink and the referral process. So, to start off, would you mind providing a bit of background on your role and what you do here at CTI?
Yeah, thanks, Ciara. I'm really glad to have the opportunity to talk about referrals with you. So, for background, prior to joining CTI, I was working in and managing a number of vocational rehabilitation programs. I also worked in domestic violence and had some experience working in small business. In 2008, I came here to manage what was then called the Maine Tobacco Helpline. And for the last 5 or 6 years, I've been working to help providers and care teams connect their patients who use tobacco to the Maine QuitLink.
Wonderful. Thank you so much for that introduction. So, to start off, I thought we could give folks a little bit of a background on what the Maine QuitLink is, what they offer, and then get into some of the questions related to making referrals. So, for a bit of context, the Maine QuitLink is Maine's tobacco and nicotine quit line, and it's been in operation for over 20 years. The services have always been completely free and confidential. The Maine QuitLink has evolved and now offers Maine residents a full array of program options for evidence-based treatment through phone and online support with trained tobacco treatment specialists, as well as free over-the-counter nicotine replacement therapy, such as patches, gum, and lozenges. Additionally, we have specialized programs tailored to serving the needs of youth and in working with people who want to quit vaping and using e-cigarettes. There are multiple ways to get connected to the Maine QuitLink. First, you can call the Maine QuitLink at 1-800-QUIT-NOW. You can also connect with them online at mainquitlink.com. And third, individuals can also ask their provider for a referral to the QuitLink, which is what we'll be talking about more today. With all of that said, let's get into some of the frequently asked questions about referrals. So, David, when it comes to working with a client or a patient, do they need to be completely ready to quit to be referred to the QuitLink?
Yeah, this might be one of the topics we confront the most, Sierra. The short answer is no, the patient doesn't have to be ready to quit, not right away or not even soon, to benefit from a referral to tobacco treatment. Perhaps the most important assistance they can get is help deciding if they want to quit and articulating the reasons why. It can be helpful to share with patients that they don't have to 100% want to quit to be able to quit. It's normal to have a number of reasons why they want to quit and some reasons why they don't. Addressing ambivalence is often one of the first steps in treatment. Still, it need not be fully resolved to move forward with a quit plan. For example, some patients feel if they still enjoy using tobacco, then they must not be ready to quit or maybe not able to quit. But that's not necessarily so. Tobacco treatment specialists are very good at helping patients work through this sort of ambivalence.
Yeah, that's some great advice, especially when it comes to working with patients who use tobacco. So, would you be able to talk a little bit about some of the other considerations regarding referring patients or clients to the QuitLink?
Sure. Yes, it's possible. And research suggests it's likely that your patient is more ready to quit than you think, but is just not confident that they can quit. More than half of people who use tobacco are thinking about quitting.
Those statistics could really be shocking to some, knowing people are truly interested in quitting, or at least receiving more information on options to quit.
Exactly. It's also important to know that about half of the folks who use tobacco make at least one attempt to quit every year. They might not tell you about it. The patient might not disclose this because they feel embarrassed or discouraged, or they might not have been successful in the past, and they might not be aware that it's completely normal for folks to take several attempts to quit before they quit for good. The chances are better than a coin toss, though, that your patient is receptive.
That's a great point. Research does show that it can take, on average, approximately 30 attempts to quit, though you might not want to tell your patients that exactly. So it might sound like a lot, but chances of quitting increase with each quit attempt. So if we frame it in a way that show our patients that the number actually shows resilience, and persistence pays off, it'll be more empowering for them to continue trying.
That is true. Finally, when they interact with the Maine QuitLink, we want them to see that there is effective, friendly help available. Referral might not result in enrollment and treatment at that time, but they may be more likely to get help in the future if they have a good experience.
Are providers able to refer a patient who was previously referred and did not enroll?
That's a great question. It's really important. Motivation to quit can be fleeting, and ambivalence can win out sometimes. So a person is never more motivated to quit than the moment they make the decision. So if a patient is interested in getting help, no matter what happened previously, it's important to make that connection as soon as possible before motivation wanes. The Maine QuitLink welcomes repeat participants because we know the research shows that a person's chances for success improve with each successive quit attempt, like you said.
Yeah, that's great to know. And how soon after a previous referral can a provider refer again?
Well, we encourage you to refer repeatedly, but we have found that it's more likely to result in enrollment if it's been at least 2 weeks since the previous referral.
Okay. And I'm curious, and I'm sure others are as well. Will the referring provider receive any type of regular updates on the patient's progress?
No, no. The referring provider will receive notification of the referral outcome. That is, that the patient enrolled or declined or that we didn't reach them, but there are no further reported updates after that.
Okay. And so when we think about some of the treatment options, nicotine replacement therapy can often be one of those options for patients. Does the provider making the referral need to write a prescription for the nicotine replacement therapy medication?
No, no prescription is required for the nicotine replacement therapy that the Maine QuitLink provides for free, the patches, gum, and lozenges you mentioned earlier. That said, we do want providers to be aware that there are patients who are covered by Maine Care, enjoy pretty good coverage for medication that covers all of those and more forms of medication and more of a supply as well. But they do need a prescription for that.
Wonderful. Okay. So some providers may have heard patients say that they feel like they're getting too many calls, that the program's too expensive, and some people say that the patches don't work. What should providers tell their patients about the QuitLink?
Boy, if my patients aren't interested in quitting is the most common thing we hear, then my patient says the quit link just calls and calls and calls is the second most common. The fact is, when the QuitLink team follows up on a referral, they will make at most 3 attempts to reach the patient. Of course, that might feel like a lot to some people. The QuitLink will not call 2 days in a row, and they won't call more than twice in the same week. I should add that the QuitLink recently moved to an appointment-based model. So once a patient is enrolled in treatment, rather than giving a 3-hour range when to expect a call from the coach, they'll get a precise time. And we hope that that'll make it easier to connect with folks, at a particular time of day.
That's an exciting shift with the appointment model coming up. And so, what about some of the concerns around cost?
Well, that's an easy one. The Maine Center for Disease Control and Prevention provides the funding for all the medication and counseling. So the treatment has always been free for any and all Mainers who use tobacco. In fact, rather than costing, a lot of people who use tobacco will start to save money as soon as they stop using it.
Yeah, that's certainly an added bonus there. So, another question that we frequently hear is whether or not the patches work. Could you give us some insight into this specific NRT?
Sure, no treatment is 100% effective, but nicotine patches, as well as gum and lozenges, nicotine patches have been shown to significantly improve chances for success. The treatment specialists who work on the QuitLink tell us that when they hear someone say the patches don't work, and then they probe a little bit, they often find that the person was not using the product correctly. That's especially true with the gum and lozenges. Reviewing the proper way to use the medication is another valuable piece of treatment. Another possibility is that if a person is a heavy tobacco user, the patch alone may not feel like enough to quench the cravings. The QuitLink offers combination NRT, so patch plus gum or patch plus lozenge, and that might help the individual feel like they're getting more of what they need. The other thing we hear is that people are not aware that people are rarely successful the first time they try and quit. Like I said earlier, it's normal to have to try several times, even with NRT.
Yeah, those are some great points on both the option for combination therapy as well as the education around number of quit attempts. So I appreciate you taking the time to review some of the frequently asked questions regarding the Maine QuitLink and making referrals for our patients. So to end off, I want to thank everyone for tuning in and listening to this episode. A huge thank you to our guest, David, for taking the time to chat. We hope you enjoyed our conversation today, and if so, make sure to visit our website at www.ctimaine.org for the recording and to stay up to date on future episodes. If you have any questions regarding any of the topics we touched on today, please feel free to reach out to us at our tobacco training email. And again, thank you so much, David.